It's part of our COVID alert tonight. Omicron racing ahead of Delta right now. It's now the dominant strain in the U.S., making up about 75% of new cases. CDC says a nearly six-fold increase in a week. Omicron discovered in Africa less than a month ago. In New Jersey, meanwhile, COVID cases are hitting levels that we have not seen during the course of the pandemic. So take a look here. 6,000 cases now, 5 days in a row. That's a first. Obviously, we know perhaps testing ramped up when compared to, say, the absolute start of the pandemic. Still, these are numbers we haven't seen. Last couple of days here were over 6,500, in fact. Not just cases, hospital numbers tonight, worst in 8 months. We're topping 1,900 tonight. As you see, the numbers continue this gradual rise here over the last several days. Almost 20% tonight said to be in intensive care.
We cannot see our hospitals get to the capacity points we experienced in prior waves. And so far through this wave, as we see here, we continue to stay at hospitalization levels that are just a fraction of what they were at this time last year, even as the recent case counts are going up with such speed.
Just a fraction of this time last year. Well, here's what he means. Take a look. We told you the hospitalizations right now topping 1,900. If you go back to this day last year, you're looking at around 3,600 in terms of New Jersey hospitals. First question, though, for the governor today was about testing. He says they're getting more capacity to meet the growing demand. Vague. The state on its website does list maybe 100 free locations to get tested, different days, different times. Planning a last-minute test before maybe seeing family this weekend, it might be harder than you think. Tonight, in need of a COVID test, some places are forced to turn people away.
We are turning away about 70 to 80 patients because we're fully booked.
Fully booked the next 8 days. Your kids' urgent care already doing about 100 COVID tests a day, children and adults.
We are seeing people coming in droves, and they're coming quickly. They're coming from far. Some people are calling from an hour away because they can't get into anywhere else.
Dozens of cars lined up after work tonight in Oakland. People showing up this morning in Union County, over the weekend in Hoboken, in part because those much hyped at-home rapid tests hard to find tonight.
That is in short supply, and we have reached out to Abbott, and they expect their inventory to increase in the next 2 to 3 weeks.
After the holidays, it was early in September when President Biden vowed these tests would be more widely available.
I'll use the Defense Production Act to increase production of rapid tests, including those that you can use at home.
And while some may want a test tonight for peace of mind, most are telling Stacy Silva they think they've been exposed.
I have a family. We tested last week. This is their second time getting COVID, and they're vaccinated. So we see a lot of it, and we see a lot of breakthrough cases, unfortunately.
But when she then follows up, she says it seems those cases lately are not as severe. Avoiding breakthrough cases, largely about timing. New research tonight showing those who got vaccinated, say, 6 months ago are at least 3 times more likely to get sick. And anyone who had the Johnson & Johnson vaccine, more likely to get COVID. The research says that. The study says a booster is the best defense.